Data doesn't lie, your go-to for the science behind the art of parenting.
Welcome, guys. This week what are we chatting about this week? It's National Dentist Day, so shout out to all my dentist friends, especially my girlfriends. You all know who you are, nationally and internationally. This one is for you, and I'm gonna hashtag y'all below. Yes, so National Dentist Day, and I mean, as the saying goes, a smile isn't a smile without your teeth, right? It just gives us confidence. It gives us a certain pizzazz to be able to express ourselves, express our joy, express our personality through our face. So I will be talking about how to just oral hygiene generally as individuals, as parents, for our kids through different stages of development. So stick around. You go grab your cup of coffee or tea. I have mine, and we'll be right back. So in talking about oral hygiene, why we want to maintain good oral hygiene or hygienic habits is because we're trying to prevent tooth decay, also known as dental caries or dental cavities. And this is important because, especially for children, it's important because it's one of the most common chronic diseases of childhood in the United States. And it's something that's very preventable. So if we can prevent it, we should. How common is it? Let's break it down into numbers for a bit. So according to the Center for Disease Control, between children aged 5 to 11 years, the 1 in 5 children will have at least one untreated decaying or decayed tooth. If you look a bit older, between children 12 to 19 years of age, 1 in 7 of them, 13%, will have at least one untreated decaying or decayed tooth. So it is common. This risk is a bit higher for children who are in families of low income or in a low income setting. So again, between children aged 5 to 9 years, they are 25%, they're 2 times more likely to have dental caries or tooth decay. So they're just more at risk. So knowing this offers us methods and ways and tools to be able to prevent it. What are the effects? What's the impact of dental cavities and dental tooth decay in children and in families? I'll break it down into short-term, mid-term, and sort of long-term complications. So in the short term, you have complications, sort of just as infection and pain. So the child is upset, is crying, impact on quality of life. Parents have to miss work days to be able to take children to the dental appointments. Children actually end up missing school, and this has actually been shown that children who have poor oral health tend to miss more school days and hence have lower grades in school. So it does impact them, not only in the short term, but in the mid to long term. Mid-term complications will include things like the effect this has on basic functions like speaking and learning and chewing and eating. Long-term complications, which are pretty significant, are things, the impact it has on bullying. So in a survey done in a grade school, this was between 6th and 10th grade, 30% of children actually reported being bullied or bullying other children, primarily due to orofacial or dental abnormalities. And we know that bullying is a leading cause of depression, or one of the leading causes of depression, suicidal ideation from depression. So all of this, it's an important topic to discuss, especially if it's preventable. So that's why we're looking at the data in order to be able to arm ourselves with tips and tools and ways to help our children. So like I mentioned, tooth decay is preventable. And I don't think I actually described what tooth decay is or how cavities happen, because it will help to understand how what we're doing to prevent actually prevents tooth decay, right? So I should probably talk about it, what exactly it is. So tooth decay is really a preventable, transmissible disease. it's an interesting way to put it. Like, you would never think that tooth decay is a transmissible disease, right? But yes, it is, because it's caused by bacteria, and bacteria can go from one person to the next person, and this will play into why we give certain recommendations to the way we feed our babies. When I'm talking about tips, I'm going to mention that. But back to what tooth decay is. So it's a preventable, transmissible disease caused by bacteria that we have in our mouth. And the bacteria on the tooth surface will produce acid, which sort of just erodes the enamel that protects the soft part, the pulp, the core of the tooth in the middle. So by doing normally, on a normal basis, we have a process of mineralization and demineralization, meaning sort of building up that bone or that enamel and sort of losing a bit of it through demineralization. So naturally occurring, that happens. When the bacteria come with the acid, it promotes demineralization, so eroding that enamel, and eventually will get to the pulp of the tooth, invade it, and then start causing pain in that pulp and then in the root. And that's what we don't want. So how we prevent tooth decay is by removing the bacteria, brushing teeth, flossing, and things like fluoride. What fluoride does is it promotes remineralization, so building back up that enamel, so it constantly is building it back up as the bacteria is trying to erode it with the acid. So fluoride has actually been shown to decrease tooth decay by 33%, and this data is backed by other data that states that children who live in communities that have fluoridated water have less tooth decay than children who don't live in communities that have fluoridated water. Again, children who use toothpaste that has fluoride in it have less tooth decay than children who don't use toothpaste with fluoride in it. So fluoride is important in preventing tooth decay. The third thing that is important in preventing tooth decay is dental sealants. Again, that has been shown to decrease tooth decay, I think, by about 25% in children who use dental sealants or is applied by the dentist versus those who don't. And again, as it speaks for itself, a sealant sort of coats that enamel and prevents that bacterial acid from eroding it, and that's just how it works. So it's important to do these things right in order to be able to prevent tooth decay. So let's talk about tips on how to prevent tooth decay at different stages. So how do we prevent tooth decay in our children and in ourselves, actually? But it all ties in, right? Because we take care of our kids and we live with our kids, so preventing it in one person prevents it in the other. We'll start with pregnant women. So the first tip is geared towards pregnant women, and it's important to establish this habit. One, not only because when we have a habit, it's something we do subconsciously, and our children, we will do for them subconsciously, and they will learn to do it. And it will not be as much work to teach them to brush their teeth. Two, by establishing that habit, we maintain good oral hygiene, because it plays a part, like I mentioned before, in feeding our kids. So pregnant women, one thing, removing bacteria is brushing teeth twice daily and flossing, right? That gets rid of bacteria. Two, we see our dentist for application of dental sealants. And three, use fluoride toothpaste when we brush our teeth. Why we do these things is because if you imagine, in feeding our kids, sometimes we pre-masticate food, sometimes we take food out of our mouth and we give our children. In fact, my daughter will literally remove something I just bit into from my mouth so that she can eat it. She won't eat the food in her plate. She'll want to eat what I'm eating from my plate or what I just put in my mouth. So being a transmissible disease, the bacteria that comes out of my mouth will go in her mouth. And if I don't have good oral hygiene, then she will get the bacteria that I have, and she's more likely to have tooth decay. So establishing that habit, starting off when you're pregnant or even before, is important, and it's safe to see your dentist even while pregnant. So don't let that be something that stops us from going to go see our dentist. Now, this tip is for babies, well, for moms, right, towards your babies. So for babies, even when they don't have teeth, it's important to practice good oral hygiene, because again, we're talking about bacteria colonizing, bacteria staying in a place where they shouldn't be. So first thing, use in under the umbrella of removing bacteria, you want to use a warm washcloth to wipe baby's gums twice a day, in the morning after the first feed and at night after the last feed before they go to bed. So you're taking away the bacteria as well as the sugar that they've had from milk, and that's sitting in their mouth, such that it's not sitting there and the bacteria have something to work on and eat and produce acid. In terms of removing bacteria as well, when the first teeth start coming in, use a soft bristled toothbrush and plain water and start brushing teeth. Again, that dislodges any plaques or any food or milk that's sitting there. Again, that sugar coated surface will disrupt it and you can wash it away. I know, and it's hard, it's going to be hard, because I know when my daughter was younger, she would fall asleep in breastfeeding, and that's how I got her to sleep at night before I started sleep training, which I quickly abandoned, but that's a different conversation. But anywho, she would fall asleep breastfeeding and I would have the cloth in my hand and it would be cold by the time I wanted to wipe her gums, but I would do just something little. I think more for myself that I was trying to do it and establishing that habit, but eventually she got used to it and she would not wake up when I did it. So try to do it. Just try to do it. You won't always succeed. You won't always do it. You won't do it twice a day. But whatever you do, you're making an effort to do it. Something I forgot to mention when I was talking about pregnant women was for those women who are very nauseous and who find themselves very sick through their pregnancy. After you're sick, after you throw up, rinse your mouth with a glass of water that has 1 teaspoon of baking soda in it, because that would help to wash away the acid, that gastric acid, that stomach acid that came up when you threw up. Again, because any acid will already add to the acid that the bacteria produce in your mouth and now just make the tooth decay worse. So that's another tip for pregnant women. And lastly, for our children, regular dental visits. So yes, brushing teeth twice a day using fluoridated toothpaste, but dental visits too are very important, and here's why. So one, you want to visit the dentist when the first tooth arrives, because you'll have that discussion about applying a dental sealant. 2, you want to visit a dentist by the child's first birthday, because you may spot, or he or she may spot, early signs of an infection or tooth decay, which they can reverse if it's early. So you want to make sure that you visit the dentist by the first year of age, when they turn 1. And then after that, regular dental follow-ups, at least once a year, because then you're talking about applying dental sealants as well as applying a fluoride coating. So those are the tips I have in terms of just general oral hygiene. And the last one would be for everyone, is really good nutrition, good healthy nutrition, because inadequate or unhealthy nutrition actually causes malformed teeth, teeth that are not strong, and actually makes you more likely for dental infections. So those are the tips I have for you this week. I hope your smiles shine bright throughout the week, and have a great week. I'll see you next week.